is Doreen Costa. I'm from North Kingstown. My question to you is, I really don't feel like you care. Okay, you told me specifically that you were going to pass this bill. Okay, those were your words exactly, and I appreciate your honesty. Okay, you have many people here that oppose this bill, and it doesn't seem, whatever we say, whatever we do, wherever we protest, I mean, you're gracious, you're kind, you're honest, but you need to give us a chance to explain why we don't want this bill passed, okay? You can take all the questions you want from here, and you can sugarcoat it all you want, but you specifically said you were going to pass this, okay? I don't want this passed, okay? Me person. I'm not a member of the mob, thanks to Mrs. Pelosi giving me that name. I'm just a concerned citizen. I just had shoulder surgery. It was a $17,000 shoulder surgery. I paid $342. Keep your hands off my medical. That's all I'm asking.
That's a very fair comment.
We're happy to ask the question.
I think Jack and I are both very energetically trying to listen to people from Rhode Island and get you. When I say that it's vitally important that you pass health care reform, that doesn't mean that my ears are closed to ideas about health care reform. This is obviously going to be a very broad piece of legislation. It has a lot of topics in it. I'm not at present convinced that we have every topic nailed down right. I am convinced of two things. First of all, we desperately need to reform our health care system, and we need to do it soon. Jack pointed out the national numbers. $24,291 is what a family policy will cost in 2016.
Why?
Let me try to get to that. Let me answer her question first. In Rhode Island, it's estimated to be more, over $26,000. So, from a personal point of view, this whole situation, as if it's not bad enough already in terms of the cost, is going to become truly out of control and unimaginable. The Medicare system right now has an unfunded liability of $38 trillion. When I got to the Senate just 2 years ago, it was $35 trillion. So with $3 trillion more in the whole, that number is going the wrong way. And it's hard sometimes to focus on how big $1 trillion is. I mean, I'm from Rhode Island. We're lucky to get into billions, let alone trillions. And so $38 trillion is the bulk of the wealth of America, all Americans put together. Homes, cars, stock accounts, bank accounts, Aunt Jane's gold locket in your dresser drawer, all of it. $38 trillion is the bulk of it. So it's a very significant liability. We have to do something about it. There are two ways I think we can do something about it. One is to throw people off coverage. But we already have 50 million uninsured, so that doesn't seem like a great idea. The other is to thin out the benefits that people get. But insured people already go into bankruptcy because of medical expense more than for any other reason, so that's not a great avenue. We could raise taxes to pay for it, but we already pay high taxes, and we already have huge health care expense, so that doesn't seem like a great idea. And the only other thing that you could do using those theories is to cut what providers are paid. But providers are already underpaid when they deal with federal patients compared to others, and there's a cross-subsidy. So you can't push that much further. So the only alternative, I think, is to reform the delivery system in ways that can save money. There is enormous amounts of waste here in the system. Hey, please be polite to everybody else who's waiting their turn. There's enormous amounts of waste in the system. It's been estimated by George Bush as Treasury Secretary it was $1 trillion a year in excess costs. The sort of best regarded Washington consultant on healthcare, $1 trillion a year. President Obama's Council on Economic Advisors, $700 billion a year. Hard to quantify it exactly, but it is a very big number. And it's a number that can change that cost curve. And we can do it in a way that improves the quality of care, that improves the health of Americans, and that makes the system easier for both patients and doctors to deal with. So that is my primary goal in all of this. And I think, as a person who represents Rhode Island Senate, I don't want to have to make those first four options. I don't want to have to throw people off coverage. I don't want to have to cut benefits. I don't want to have to raise taxes. I don't want to have to pay providers less. I want a system that delivers more effectively the health care that Americans deserve. So
again, the whole thrust of the proposal of the president is to, if you like the insurance you have, you can keep it. We've tried to build that into the system. We've tried to maintain employers-based health coverage, which is getting less and less and less. Particularly for small businesses, which pay 18% more than state health. The other issue, I think, is just an example of, the system and why we're paying for inefficiently. It's estimated and accepted by experts on both sides that approximately $1,000 of private insurance is covering uncompensated care in hospitals. People without insurance will go in the emergency room, they're getting coverage, and I think everyone goes, well, we've got to help a person in an extreme condition. That's not, doesn't go up into the air. It's shifted on the private insurance companies and hospitals who have to pay for it. If we have everyone covered, at least they will be making some contribution, in fact, the principal contribution to their own care and hospital. That's just one example of how, and that's a very straightforward example, how we can make the system more effective, efficient, and less costly.